All right, welcome everyone. As a clinician, you're constantly facing this challenge of keeping up with all the latest research, right? So how do you find the real, evidence-based answers? Well, today we're going to break down a fantastic guide that offers a powerful solution. It's all based on the article, How to Conduct and Publish Systematic Reviews and Meta-Analyses in Dentistry, from the Journal of Aesthetic and Restorative Dentistry. And trust me, this is a total game changer for making those tough clinical decisions.
I mean, just think about it for a second. A new composite hits the market, or a new implant system, maybe a new digital workflow. Suddenly, you've got patients asking you about it, sales reps are all over you promoting it, but how in the world do you cut through all that noise to figure out what really works best for your patients? Where's the solid ground in all of this?
And that question? Well, it brings us right to the core message of this article. This quote from the abstract really says it all, doesn't it? The idea is that these systematic reviews, they're our best tool for taking a literal mountain of research and boiling it down into clear, trustworthy guidance. Guidance we can actually use, the kind that helps us make better decisions and, at the end of the day, improve our patient outcomes.
So why are these reviews so critical right now? I mean, why is this so important? Well, it really boils down to one huge issue that I know every single one of us is facing, and that is the evidence overload problem.
Let's face it, the reality of modern dentistry is that the amount of literature out there is just massive, and it's growing every single day. New materials, new techniques, they evolve so fast it feels almost impossible for any one of us to keep up. And then, on top of all that, we have to try and balance the hard clinical results with what our patients are actually experiencing. It's a huge, huge challenge.
Okay, so what's the solution that this paper is really championing? Let's get a crystal clear definition of what we're even talking about when we say systematic review.
So, at its heart, a systematic review is this powerful thing called evidence synthesis. Think of it this way. Instead of just relying on one single study, which, can have its own biases and limitations, this process goes out and gathers all the relevant, high-quality research on its specific topic. Then it pulls it all together and summarizes it to give us a single, concise, and, this is key, unbiased look at the very best evidence we have.
Now here's what's so fascinating about this. These reviews are incredibly targeted. This isn't just some random grab bag of papers. A systematic review is meticulously designed to answer a very specific kind of clinical question. So for example, if your question is all about treatment effectiveness, the review is going to hunt down randomized controlled trials. If you're asking about diagnosis, it's going to prioritize diagnostic test accuracy studies. It's all about making sure the evidence is a perfect match for the clinical problem you're trying to solve.
Okay, but how can we be so sure that the summary it gives us is actually trustworthy, right? How do we know this isn't just another opinion? Well, the answer lies in the rigor of the process itself.
And this is probably the most crucial point to understand. The entire value of a systematic review comes from its method. The whole goal is to minimize bias at every single step. The entire process is designed to be completely transparent and reproducible. And what that means is another research team could follow the exact same recipe, the exact same steps, and they'd get to the same conclusion. Now that is real scientific rigor.
Yeah, this is a far cry from a casual literature search. It is a meticulous, multi-step process. It all kicks off by defining an incredibly focused question, usually with something called the PICO framework. That's patient, intervention, comparison, and outcome. From there, they do a super comprehensive search, they have a really strict selection process, and then they extract the data. After that, it gets synthesized, often using a really powerful statistical tool called a meta-analysis to combine all the results. It's only after all of that work that they can finally draw conclusions based on all that combined evidence.
And within this whole process, there's a clear hierarchy of evidence. Not all studies are created equal, right? For questions about what treatment works best, randomized controlled trials, we call them RCTs, they are the gold standard. They're at the top of the pyramid because they have the lowest risk of bias. But look, sometimes RCTs just aren't practical or even ethical to do. And in those cases, well-designed non-randomized studies can still give us some really valuable insights. A good systematic review knows exactly how to weigh and include those properly.
Okay, so we've covered the what and the how. Now for what I think is the most important part. What does all of this mean for you, in your practice? At the chair side with a patient right in front of you.
Well, this is the ultimate benefit, right here. A systematic review basically does all the heavy lifting for you. It takes that confusing, completely overwhelming mountain of individual research studies and distills it all down into one single, powerful summary that is directly relevant to the decisions you have to make every single day.
I mean, the clinical implications here are just huge. First off, and this is a big one, it saves you a ton of time, an enormous amount of time. Second, it empowers you. It lets you inform your treatment planning with the absolute highest quality of evidence out there. And that directly helps with that critical step of turning new knowledge into what you actually do in practice. Which, of course, leads to the thing we all want: better, more predictable outcomes for our patients.
And this final quote from the article, I think it just brings it all home perfectly. That whole rigorous methodology we talked about, it's not just for academics to argue over. It is the very thing that makes these reviews comprehensive, unbiased, and actually relevant to us in the clinic. You could say it's the engine that drives better patient care and helps us all achieve better clinical outcomes.
So I'll just leave you with this thought. The next time you're in the clinic and you're debating a new procedure or you're choosing between two different materials, what kind of evidence are you going to seek out? Are you going to rely on that one single study you saw, or are you going to go look for the powerful synthesized evidence that you'll find in a systematic review?